Hey everybody, welcome to Health and Wellness West Georgia. I'm Dr. Allison Key. My bestie Erika Smith is here. We're from 316 Healthcare and we are your hosts for this educational program on health and wellness. How are you?
I'm wonderful. How are you?
I'm
Except
good.
fall allergies have crept up on me.
Oh my gosh.
So, I promise I don't normally sound like this.
Had some viewer questions, and one of the ones we get pretty frequently is, what is your actual name? Like, what's the difference in Spa 316? And we've been called everything from 316 medical to everything. You put medicine, doctor, spa, healthcare, family, and 316 in any order, and we've been called it. We've probably been called some other things, but we'll not discuss that. We're going to talk about the positive things today. So 316 Healthcare is sort of what I'd like to call a parent company. It's like the overarching, like, covers all of it. It's technically what our taxes are filed under, is 316 Healthcare. And then there's two branches under that. We should have a visual. We need like a chart.
Oh yeah, like a marker board back here.
Yeah, we should do that. 316 Family Medicine, and I'll kind of break those down. And then we have Spa 316. So Spa 316 is primarily aesthetic, health and wellness items that insurance doesn't traditionally cover. And then 316 Family Medicine is a more traditional approach to medicine, and we do accept insurance at all of those offices. So that's one difference in those services. But tell our viewers, I already know all the things that Spa 316 offers.
Okay.
It's a long list.
It is a long list. So anything you could possibly think of that a spa should do, we probably do it.
Yeah.
We have two different locations. So our first location is in Bremen. I shouldn't say first, but it was our primary. We're actually in the big White House across from Family Medicine. And then our second location is on the square next to Little Jim's, the barbershop. We do anything from massage therapy, like a therapeutic massage, pregnant massage. We do skin services, so facials, microneedling. We do laser services, laser hair removal, photofacials, skin tightening. And then we get into injectables, Botox, fillers, PDO threads, PRP injections, hair restoration. We do HRT, so I know you talked about a little bit different approach to wellness. So we look at a more holistic approach, kind of addressing the whole scenario versus just providing medications. So we do hormone replacement therapy and then weight loss.
Yeah. And weight loss has become very popular recently. Ozempic, Wegovy, those are brand name drugs that are used for diabetes. They're super effective. In my opinion, they're sort of revolutionary for the treatment of type 2 diabetes. There's a recent study that showed positive effect for type 1 diabetes even with Ozempic.
And cirrhosis.
Yes.
Not necessarily cirrhosis, fatty liver.
Fatty liver disease.
Like reversal.
Lower cardiovascular events. Like, there's tremendous benefit from those drugs. I think they're going to be revolutionary, and patients are tolerating it very well. But the positive side effect is weight loss on those medications. And because there's a national shortage, and we'll get more into weight loss programs in a later episode because we got a lot of questions about that too, but there's a national shortage, compounding pharmacies can take a brand name drug that has a trademark and a, what's it called, patent on it, and compound it and sell it. So a lot of offices now are able to offer not covered by insurance, because insurance is only going to cover those brand name drugs if you are a type 2 diabetic. That's pretty much all there is to it. Wegovy, for some insurances, is covered for obesity and will be covered for weight loss, but there's a national shortage that they don't anticipate will be resolved until January. So you can get semaglutide or similar compounded drugs that have NAD or B6 or something like that in them to help with the nausea, generically compounded, and it's a really popular program. It's been super life-changing for lots of people.
Absolutely.
And the HRT, we're going to do a whole other episode on that, but it's bioidentical pellet therapy. But we really try to explore all the all the things going on with the patient, not just throw medicine at it, so to speak, and find a target balance. We kind of believe like there is this spectrum of normal, like on a lab value, like from here to here, but that's a 95% confidence interval. There are people that are going to feel best out here, and so you really just got to, it's a combination of listening to your body and your metabolism and your makeup and your genetics and your background and your personal experiences and all those things combined. Deep tissue massage, sports massage, medical massage, which sometimes is covered by insurance with a referral, but that's run a little differently, but still provided as a outsourced through the spa. Both spas, coincidentally, are housed in 100-year-old, over 100-year-old locations, which I'm a sucker for an old building.
We need to do like a Halloween one.
We should do a Halloween episode.
For the Bremen Spa, because it's haunted.
They say it's haunted.
It's haunted.
Ain't no ghost but the Holy Ghost. I'm just kidding. I think there may be a spirit living in that house. I love old houses, though. They're both beautiful, unique locations. The Carrollton Spa will fool you. You think it's a little bitty location. You go in, and then you start walking back, and everybody said, "Oh, I didn't know it was this big." And I was like, "Well, you haven't even seen the basement yet." And
right.
you go downstairs.
It's quite deceptive.
Huge, yeah. So they're both beautiful.
We have a huge retail space, so we sell supplements, skincare items, protein bars, protein shakes, and little knickknacks.
Some gifty things, usually cute T-shirts. People ask us a lot, where do you get those cute T-shirts? So we get them at the spa. We get them for ourselves and for all of you. So it's a great place to really invest in taking care of yourself. And I know for myself personally, as a working mom for years, I did not take care of myself at all. Prioritize everybody else, and at some point you reach that limit where you're like, I cannot pour out of an empty vessel. Like I cannot continue to take care of everybody else if I cannot take care of myself. And the spa was a great starting point for that. Support system, especially those weight loss patients. I think one of the things that we do really well is that support and education. Even I sometimes have to stop and think, okay, what have I eaten today that's good for me? You know, and so that support and really learning how to eat and learning how to eat healthy when you're on the go, when you're busy, and retraining all those habits. There's tremendous support in that. So on the family medicine side, like we said, it's a more traditional medicine approach. We accept insurances at all the offices. So we have one of these locations in both Carrollton and Bremen. They all fall under the 316 Family Medicine heading, which is, again, under 316 Healthcare as a whole. And Spa 316 is our sister business. But 316 Family Medicine is sort of our traditional family medicine office. Wellness checks, chronic disease management, diabetes, hypertension, depression, anxiety, ADD, cardiovascular disease, COPD, urinary incontinence, you name it. We are excited. We're going to be adding to those services on the family medicine side some pelvic floor therapy with radio frequency, some sort of a laser device. That's going to be exciting, but that's coming. But that's sort of our traditional adult family medicine office. DOT physicals, yeah, we do DOT physicals. And then we have added, both in Bremen and Carrollton, 316 Family Medicine Kids Corners. So we were seeing a ton of kids in our family medicine office. We hired Amber Boyd as our first peds nurse practitioner, and then it really exploded. And so we said, we need to have like a dedicated space for these kids. And so we have had a lot of fun opening 2 Kids Corner locations, one in Bremen, one in Carrollton. Because just like for our adult offices and at our spas, what I wanted for the kids' offices is for kids not to be afraid to come to the doctor. And I want adults, grown men, not to be afraid to come to the doctor. Like I want people to feel welcome and comfortable when they come in. We know your name, we know who you are, and this is going to be a place that you feel comfortable coming. And so those Kids Corner offices have been so much fun. They're super cute. We have some fantastic providers. Dr. Amoa, who you'll see in another episode. Coming up soon is our pediatrician on staff. She's amazing, so sweet, so precious, so knowledgeable, loves kids, and is so good. And then we have urgent care locations in both Bremen and Carrollton. The Carrollton urgent care is going to be opening probably mid-October, so we've got a few more weeks, but the office is ready to go. So when you go by there, you can stop in because infusion therapy is on one side. But urgent care, just like what it sounds, you're sick, it's not sick enough to go to the emergency room, but you can't get an appointment with your regular provider today because they're already full, so you go in and you're seen there. We do DOT physicals there as well. And then we have infusion therapy offices in both Bremen and Carrollton that fall under that 316 Family Medicine. Brittany Sleek, one of our nurse practitioners, she'll be on another episode talking about a really specialized therapy we do there, which is called physiologic insulin resensitization, specifically designed for neuropathy and diabetics, but there are lots of benefits to PIR for other patients as well. But we also offer just normal saline, like for rehydration, vitamin bags, what else? Antibiotics, phlebotomy, therapeutic phlebotomy when you have to have blood drawn off. So all kinds of services that we offer at our infusion therapy. And that can be walk-in cash pay kind of services as well, or run through insurance. We do some athlete hydration clinics for local athletes who either want pre or post-game rehydration to kind of help, especially when it's so hot outside. It's really important, and it's hard to get adequately hydrated. If you've never had an IV for hydration, you should try it if it's medically appropriate. It does make you feel incredible, invincible even. But it really does kind of help you bounce back, re-energize. So I think that kind of, hopefully that helps answer some of the questions about who we are and the breakdown of our services. But there's a good chance you'll see one of us at any of those locations. Several of our providers, when we first started, we all sort of split our time between family medicine and the spa. Well, when we first started, we were all in one building, and family medicine was on one end and the spa was on the other, and that only lasted about 6 months, even though we thought that might last the rest of our career. After 6 months, we had to expand that, but for the first 2 or 3 years, all of us kind of split our time between, so you might see us anywhere. As we've continued to grow, we've all sort of found a home and a niche, and like, this is what I love to do, and this is where I want to be. So primarily, you're going to see Erika at the spa locations. I might be anywhere on any given day, but that's how I like it, and I like sort of seeing everybody and seeing all the new faces, not just patients, but our employees. We continue to grow. We got some other things coming up our sleeve for late 2023 into 2024. Never know. People send us all kinds of great ideas. All right, we're going to have some more great episodes coming up. That's kind of who we are, the breakdown of our offices. We're going to cover stuff. We've had questions about, one that I loved was, Dr. Key, I've got my first big girl job, and they're offering me benefits. Like, can you explain to me the difference in, like, what all this insurance cost is in these packages? So we're going to have Noelle on. We're going to talk about health insurance, a really exciting topic. But it is important. I mean,
you need to know.
I was a grown adult, like really an adult before I was like, oh, that's what a deductible is.
And it can still get confusing.
It can get very confusing. There's co-insurance, there's all this stuff, and so we'll kind of help unmuddy that water for people a little bit. And then sometimes you think something's going to be covered at 100%, and then you get a bill for it, and why did that happen? And so we'll talk about some of that sort of thing. Oh, that'll be fun. We're going to talk about we're going to have Dr. Mo on. She's going to do some episodes geared towards our kids specifically. We're going to talk about the pellet therapy, the weight loss, the HRT, all the things. It's going to be great. Not HRT, PIR. We're going to have some good stuff coming up. So stay tuned. We're going to give you some tours of our offices coming up soon too. So we hope you'll tune back in to Health and Wellness West Georgia. Till next time, y'all take care.